theater today, eh? So you're watching theater today?
So again, this critic is coming to you for daybreak news, reporting a fire that has moments ago occurred at the Georgetown Hospital. It is I think this is the ICU area, and the fire has completely gutted one room. The fire chief is presently giving an update to reporters while investigators from the fire department are working in the room, just to give you guys an idea and still keep out of the way you would see the damage that was caused by this fire, and it has completely gutted one room. Completely in a moment we will I think this says Eco Lab Scanning Room 2. So in just a moment we'll talk to the person in charge here down at Georgetown Hospital, Minister of Home Affairs, Robeson Ben is on the ground also, and the Minister of Health is also on the ground here. So we will get an update from them as to what exactly transpired here, and I'll talk to the fire chief also when
Good morning, I'm Robbie Ramran, acting CEO of Georgetown Hospital. Approximately 5:40 this morning I received a call that there was heavy smoke emanating in the intensive care unit and the cardiac intensive care unit. It was also reported to me that the fire service was informed and they had responded in a timely manner. I subsequently came down here, and as on the scene, they were able to identify the location of the fire, which emanated from the Eco Lab. From all indications that the room was secured, the individual came out as well and verified that the room was secured yesterday afternoon when they left. It's at this time we can't see the cost of the damage, but we have very expensive equipment. There is an echocardiogram machine, which is roughly about $20 million. From preliminary investigations, there are oil-based substance in the room, which leads to the suspicion that this may be arson, but the investigation will continue.
So, that news that there's a machine that is going to be used. What other machines were in the room?
That was the main machine. It's used to do echocardiogram of the heart, and there was like a bed and other desk and computers, cabinets, more or less. Lots of patient records, air conditioning unit.
Can you say what is in place presently for the patients who would be affected? I think this helps a lot of patients. Is there a backup plan?
So immediately the patients were evacuated from the ICU and CICU. There were 7 patients in the CICU and 4 in the ICU, and they were transferred to a ward in the new inpatient building, and there were only one the severely critical patient who is on a portable ventilator. Presently, there is no risk of those areas, but once the smoke, this smell of the smoke is fade away, we will transfer the patient back in.
And as it relates directly to this room and what this room does and how it helps patients, how will patients be affected, and what will be put in place to as a kind of backup plan to have the machine back and that service?
Well, obviously this will affect our services. this, like I said before, is an echo machine that do an echo of the heart, and this is a clinic that is kind of overloaded. In our 2022 budget, we actually put in to buy an additional machine because of the demand here for this service. So now that we are suffering the loss of a machine, then you can see that we are back to square one when we get the new one. So we'll have to make some deliberations to probably get 2 instead of 1 now. So yes, it should surely affect our services.
Okay, all right, thanks. So we were hearing from different persons as it relates to the management of Georgetown Public Hospital. And for those of you who have just tuned in, the Guyanese Clinic is coming to you from Georgetown Hospital, where a fire occurred in one of the rooms in the ICU department this morning, around 5 hours. And the fire department has their investigators on the ground, and you can see they're taking photographs. I don't know if the Guyana Police Force will be sending over their investigators, but I'll take you in the room just and give you a little show of what that looks like. It's a completely gutted room, and this is going to affect patients with heart problems gravely.
Well, as Director of Medical and Professional Services at the Georgetown Hospital, when there are incidents like these that occur, I am usually notified. So I was notified at about 5:43 this morning that there was this emission of smoke coming from this area, which would have been affecting the patients in the ICU and the CICU. And the nurse who was the supervisor took the decision to mobilize the patients, move them to a safer place. So that information was given to me. I asked her to get some more information to me while I was on my way down to the hospital. I came here and then I got involved in adequately relocating the patients to places that would make their management much better. There were 7 patients in the CICU who were relocated. The ones who did not need any severe monitoring, they were put in a ward that we have dedicated for eye patients, but it was empty, so we put the 4 patients there. The one of the CICU patients that needed better monitoring was put in the recovery room, and 2 in the induction area in the operating room. The ICU patients, which were 4 in the ICU, they were transferred from the ICU to the recovery room of the operating room. So all of the patients who may have needed any form of adequate monitoring and care were provided that care even in the emergency setting. So presently the patients are all housed adequately and receiving the attention. The nurses who would have been those who would be attending to them in their relative departments have also been relocated to the places where their patients are, so they are giving them the service that they need. We are hoping that once this settles down and the environment gets better for the patients, we will be able to relocate them to their departments. Going back to their departments, once there is no smoke or anything that, the smell of smoke that is affecting them, then they will be able to be comfortably in their place with their nurses and their monitors and everything. So everything is in place. Those patients are all now being adequately treated and managed, and there is no one suffered any adverse effect from the incident that occurred this morning.
All right, so you've heard from another one of the individuals who is in the admin department. You've heard from the acting CEO before, and you got a couple of fire extinguishers here. For those of you who've just tuned in to the Guyanese Clinic Live, coming to you from Georgetown Public Hospital, the ICU area. And this is, as you see here, Eco Lab. It says scanning room 2, and this is set to house a machine to the tune of $20 million. You're hearing from the, let's go to the Minister of Health, who is going to give his input now.
So, what are the steps being taken to minimize the interruption of operations?
Well, first of all, let me say that I want to thank the Guyana Fire Service for the prompt response. I understand minutes after it being reported that they were here, and because of that prompt response, we were able to save the surrounding rooms from where the fire emanated. I also would like to thank the nursing and other personnel who would have seen the smoke and reported it as quickly as possible so that action can be taken. And I guess because of their prompt action that we have minimized the damage here. So we are very grateful that these persons were very diligent in what they were doing. And also because they were able to move the patients very quickly. You had 11 patients in the CICU and about 4 patients in the ICU that had to be moved, and they came together very quickly and moved those patients so as to prevent any problems relating to inhalation of smoke. So I'm very grateful to all the persons who were involved this morning in trying to minimize the damage. In terms of the disruption of services here, this particular unit is a unit that is used to do echocardiograms, meaning that persons with heart disease, when we want to see how the heart functions, this machine helps us to do that. So it's a very unique piece of machine. It costs a lot of money, and therefore we'll have to now put additional budgetary resources to replace that piece of equipment. So apart from the equipment, you have beds and other things in there that would have been burnt. Nothing that is in there can be used. So we'll have to replace those things. The police and the fire department, as I understand, having some preliminary conversations with them, believe that this is a suspected arson, and if that is the case, it is really, really disappointing that someone or some set of persons, whoever it is, would come to a hospital that is serving people when they're sick and vulnerable and try to do something like this. It's really a dastardly act to try to burn a hospital. And so I would like to condemn it in the gravest of terms, because this should not be allowed in a civilized society. So, we have to be vigilant, because this is not the kinds of behavior that we want to see from our citizens. Because this hospital saved lives, and we don't want to put and endanger and jeopardize people's lives. And this morning, we came close to that, if it wasn't for the vigilance of the staff here, and of course the prompt response from the fire department.
And you said you guys would have budgeted for another machine to be replaced. So can you see if operations will be put on a hold because of this?
So we'll on Monday we'll have to do a quick review, and then we'll see how we can source another one of these equipment as quickly as possible. But certainly there would be some amount of disruption, perhaps for a couple of months, as we get that new piece of machine in place. These machines, obviously, we'll have to buy them from one of the manufacturers abroad and to bring them into Guyana, so that would take some time for us to be able to do that.
And can you say, due to this, how severe, because I know you're saying that the persons who usually get tested and stuff like that from this machine, can you say how this will affect those persons and their care?
Well, this here, a couple of things. One, this piece of equipment would allow us to make more precise diagnoses of person's heart condition. So it's a very integral part of helping to diagnose types of heart disease that the patients would have. So a lot of our patients, whether they're outpatient persons or persons who are in the hospital, require the service. It's almost kind of a routine. Once you do the preliminary workup, that you'll have to get an echocardiograph. And based on what you're seeing on the echocardiograph, that then informs what are the next steps that a person might need to get. So it is a very critical, important piece of equipment that has been damaged. And the estimates from the CEO is approximately $20 to $25 million. So it is a substantial sum. Nevertheless, we are going to work to make sure that we can replace it as quickly as possible. So for the next maybe couple of months, there would be some amount of disruption.
Minister, you said the next couple of months there will be some disruption, but I'm trying to grapple with the fact that is there a likelihood that persons can lose their lives as a result of the hospital's inability to diagnose them early? Is there any possibility of that?
We would use alternative methods. So we'll have to use other things to make sure that people's lives are not in jeopardy. But this piece of equipment would have helped us to do some very specific diagnosis, and that's why this is so important. And in fact, it's going to compromise our cardiac program. We were hoping that from the 1st of June this year that we would have restarted our pediatric cardiac program. And this is a very important piece of equipment to screen for those patients. We have been screening and making up a list. So this now would disrupt that cardiac program, probably set us back some amount of time as well. It would also have an effect on the adult program. So it is really, very malicious for someone to, or some persons, I don't know, to damage, to burn, to destroy the equipment that is housed there.
Yes, Minister, thank you. So you would have heard from the Minister of Health speaking on, and you're going to hear from the Minister of Home Affairs now, and he will be able to explain more in depth as it relates to the fire itself. Good morning, Minister.
Good morning, and a happy new year, nevertheless.
Same to you. Minister, we are here this morning, and it has been, since your administration has come to power, it has been, there have been numerous instances where there are fires of a lot of times unknown origin and suspected to be arson. This is, all indications seems to be one of those, very unfortunate. Can you say what is your take on this and what is going to be put in place, since this is the first day for the new year, to relieve citizens of having to wake up and not knowing what will happen next as it relates to fires in Guyana?
Yes, well, it is true that for the last, I'd say, 9 months or so, that a definite pattern has been established where fires of a highly suspicious nature related to arson, acts of arson, have been experienced. We, of course, have had the loss of institutional buildings, the police force, and schools, and those have been particularly pointed along the way of arson as being the cause. And now we have this one at the Guyana Public Hospital, the premier health institution in the country. This can only be, given the information and the evidence we have at hand so far, in our view, again related to arson, and again related to times at which vigilance, oversight, the witching hours, as one may want to say, where things could happen, and the vigilance is not as high perhaps as it could be. We, of course, condemn these acts. These couldn't be attacks on the government itself. These are attacks on the people, and in this case, particularly sick people, and its only result would be otherwise to impair the health and well-being of people who are already in distress. So I want to condemn in the strongest possible terms this event and all the others related, and the seeming willingness perhaps in some quarters to accept that this may be a legitimate resort towards resolving issues they may have, whether it's domestic, political, social, whatever. Again, I want to call on the institutions, and we want to work along with the institutions of government and even in the private sector to improve the vigilance, the fire protection implementation plans, the question of the use of smoke detectors as one of the cheapest and earliest interventions they can put in place, and other smoke alarms, and also extinguishers and other means of fighting fires, and to have staffers trained in their use and in the response to issues of fire. I am very encouraged by the robust and quick response of the Guyana Fire Service, by the support provided by the Guyana Police Force otherwise, and particularly too by the staffers of the GEORGETOWN Public Hospital in relation to this incident. And to call again on the administrators of the institutions and all those concerns and everyone to protect the nation's assets and also to protect people, to work to protect people.
Right, Minister, thank you.
Yeah.
So you would have heard from the Minister of Home Affairs, and while the Guyana Fire Services continuing their investigation, I could give you a small peek of what exactly is going on here. Firstly, you see the door was obviously locked because the door had to be broken into to get inside. The fire was said to have originated on a bed here, and just not to interrupt anything, there's a bed here, there's the cardiac machine that was damaged, this is the bed, and this room is completely gutted, and as you see, it had already started to come out the windows, the fire had already started to come out the windows, and this could have spread to numerous areas, causing, there's another room here, also just very close, and these rooms, you know, the roofing is hollow. I think this, to some extent, the material that is used in the roofing is fire resistant. So you see, it's caused a bit of a mess here because the fire department obviously went around here to try to make sure nothing was coming over, and the water damaged the ceiling to some extent. But this also is a lot of expensive equipment here that would have been saved. And what is my real concern and worry is how people are affected. There's another room just neighboring, a lot of equipment here too. And the bed that you see burnt would be similar to this bed. And I asked the fire department earlier if there are any electrical components on the bed to understand, for my understanding of what the origin of the fire would have been. And again, the door was locked. How did this happen? Who was responsible for this? As you can see, there are number 6, to be exact, fire extinguishers here. So the Minister of Home Affairs is very much up in praise to the fire department and staff of the GEORGETOWN Hospital for the work they've done in being vigilant. And it's very unfortunate. I must say unfortunate. If you look at this you know, this Christmas spirit is still here, and I could only imagine the devastating feeling the staff has knowing that you have people and you have patients who you want to take care of for the new year, and to come and find out you will not be able to take care of those persons. What exactly transpired here is yet to be ascertained by investigators, but initial investigation suggests arson. Whether or not that is so, the powers that be have to deal with that and see how they're going to address that and protect the citizens and the property of the state and the citizens of this country. Nonetheless, Guyanese citizens are directly affected as a result of this fire here. And if you go back, if you've just joined the live, the Guyanese Critic is coming to you from Georgetown, the Georgetown Public Hospital, where a fire has occurred in the ICU department. One of the cardiac testing, heart testing machines, the room that housed that testing equipment has been completely gutted, and fire investigators are on the scene and have started their investigation. To some extent, a substance that is thought to be flammable, oily substance was seen in certain areas, and obviously tests have to be done to figure out whether that is as a result of the heat causing a sponge to melt, or if it's a direct result of a flammable substance being poured on the bed. This door was closed just to help you, just to give you an understanding. The door was closed and it would have to be broken, right? So, and then, does the bed have any electrical components? I asked the fire chief, he said no. So how exactly did the fire start there is yet to be ascertained, and investigators are working on getting that information for us. So you would have heard from the minister, you would have heard from the acting CEO of the hospital, you would have heard from a number of individuals. And Guyanese, this is once again very unfortunate that we have to start our year this way, whereas some of our Guyanese brothers and sisters, and you would have heard the Minister of Health suggested even children, the pediatric heart setup was supposed to be operating out of here. Unfortunately, their treatment and early diagnosis has been hindered. I asked the minister and he said things are being put in place to ensure those people get help as soon as possible. The Guyanese Critic for Daybreak News.